Thurman, our big story right now at 10 o'clock is a Local 15 reality check. A little-known health clinic in town is costing taxpayers big bucks to run.
Yeah, about $500,000 a year, in fact. The clinic is just for Mobile County workers. As Local 15's Andrea Ramey reports tonight, not many patients are walking through those doors, Andrea.
Well, Greg, not many at all, and though it's just been open a few years, county commissioners are already talking about closing it.
These doors don't get much use throughout the day. That's because lately, on average, just 6 patients visit the Mobile County Commission Employee Health Center daily.
Very few employees will actually use it.
Compare that to Dr. O's urgent care on Airport Boulevard.
We might see 40, 50, 60 patients a day
In the summer.
In the winter months, when more people are sick, he sometimes sees 90 people a day. That's almost how many patients went to the county clinic the entire month of December.
So with these numbers in the private sector, what would happen?
Fell. It would be terrible. We wouldn't be able to stay open.
In the 2012-2013 fiscal year, taxpayers spent $555,000 to keep this clinic open, much of that paying for infirmary health staff. And while it's costing you, it's costing employees nothing. That's one of the biggest benefits to coming to this clinic is that there is no copay, but it's costing taxpayers roughly $330 per office visit.
The no copay is really helpful.
Now, don't get a bill afterwards from the doctor, because normally if I go to the doctor, I would receive a bill a few weeks later.
That's one of the few little benefits I think we've picked up over the last 4 or 5 years.
The county workers who do use the clinic say the low turnout is actually a positive for them.
I don't have to wait long at all.
Not much of a wait at all compared to your regular doctors.
Are there any other people there at all when you go?
Rarely.
You would be like the only patient.
Exactly.
We need that money in other places.
Mobile County Commissioner Jerry Carl says he would like to take the money from the clinic and use it to pay for worker raises.
Employees that were hired at the bottom scale 7 years ago are still making that same amount of money. So we've got to figure out how to get more money to them.
Closing the clinic may be a way. As it stands now, no money has been set aside in the proposed budget for the clinic. No money means these doors stay shut, and that's just fine with Commissioner Carl.
I hope we can close it and move on.
Some workers say they hope that doesn't happen.
I'd be devastated.
Soon the commission will decide if taxpayers will continue to pay for this perk.
Now the county votes on the budget this Thursday. If the budget passes as is, commissioners estimate the clinic will close early next year. Kim and Greg.
All right, great story, Andrea. Thank you. Now, Commissioner Merceria Ludgood said she would like to see it stay open.
Local 15 News is your advocate to expose corruption, fraud, and waste in local governments.
If you know of any wrongdoing, scams, or abuse of your tax money, call our reality check hotline. The number is 877-315-7268.